Here with me now is Dr. Steve Hosea, a medical doctor here in the city of Santa Barbara, where the conference on cannabis therapeutics is being held. Thank you very much for being here with me for a few minutes. Dr. Hosea made this incredibly moving presentation on HIV and cannabis. And as I understand it, you moved here and you came here and you immediately started working with AIDS patients. Is that correct?
Well, I moved here in 1981, so that was really the beginning of the epidemic. I didn't realize what I was getting into when I moved here.
And how did you get involved with AIDS patients?
Well, I do infectious diseases. That's my specialty, and therefore it was natural to take care of people whose infections were the major result of a depressed immune system.
And so you've been intimately involved in the change of the face of AIDS, one might say, over the last 30 years, 25 years.
But that's exactly right.
And what do you think? You were here and you talked about, when did you first recognize that cannabis had some therapeutic value in AIDS patients?
Oh, I think probably 83, 84, because one of the major problems was wasting and weight loss that occurred. And we were really trying to find solutions for that, and we didn't have any good medicines, at least FDA-approved medicines anyway, and there's no question that cannabis clearly affects appetite. We use a lot of anabolic steroids as well. One of the questions I have is really which one works the best, or does a combination work best to help with wasting and weight loss?
How did you just come to find that cannabis would be a benefit? How did you discover cannabis?
Well, at a time when people were dying all around me, we were doing anything we could to try and save people's lives. We were getting money or getting pills from buyers clubs. We were using alternative medicines. People were using cannabis, and anything that we could use that would help, sort of by word of mouth. We'd say, well, how do you put on that 5 pounds? And they'd tell me, and so then I would tell someone else about it. It was really more a word of mouth that it.
And you're here at this conference. What do you think of the conference that you've been seeing the last couple of days?
I think it's an incredible conference. I've obviously been an advocate for medical marijuana for a long time. I honestly didn't realize all the other wonderful effects that medicinal marijuana has, and I actually, after hearing its effect on neuropathy pain and multiple sclerosis, I, at one of the breaks, called one of my patients and said, we need to get you some marijuana because it has dramatic effects and what we're doing isn't working. So lots of new information.
So actually, a direct benefit to one of your patients from coming to this conference here.
Unequivocally.
And one of the things we've had some problems with is working with our local AIDS patients group, the Desert AIDS Project, and they seem to be very fearful of marijuana. They won't allow it to be discussed. They won't allow our information to be put out there. They're afraid of dealing with marijuana. Why do you feel that is?
Well, the major reason that's the case is because they're not here at the conference. If they were here, it's all about education. I think the best way to fight the fear is with education. And how do you get people educated? One of the hardest things to do is educate physicians about new, different concepts. To me, that's the exciting part about this particular conference.
Okay, well, maybe we can get you to come down and talk to some doctors here about your experience with AIDS and marijuana as medicine. A lot of our viewers, and I know our people come to our meetings are AIDS patients, and now we have it direct from a doctor. You're doing the right thing. Doctor, thank you very much for joining us here, and see you more at the conference.
I hope so. Thank you.